noticed all these celebrities have perfect teeth? How's that possible? I don't know. I have had these things, and I thought about it. I thought about it many a time. Christal Young, I don't know what it takes, but you know they're spending some big dineros on those teeth.
They are. So celebs get perfect teeth by getting veneers. They're an easy, quick fix. They do cost a little bit of cash, but literally in hours you can transform a smile. A lot of people are doing it. A lot of people are talking about it. So consider this like Veneers 101. Take a look.
Dr. Catrise Austin has cared for the teeth of lots of celebrities.
Isaac Hayes in 1998 was my first celebrity client, and I've worked with Missy Elliott and Busta Rhymes and Paula Abdul. Common.
DJ Khaled is one of her happy former patients. Her most popular request, veneers. Cardi B started out like this.
I got crooked teeth and sorry for letting them look at my titties.
But ended up with a perfect smile thanks to Dr. Austin.
Why not go to the best? Like, I personally recommend Dr. Catrise.
Cardi loves her smile transformation so much she even rapped about it in her hit song, Bodak Yellow.
As soon as that song went #1, TMZ called my office like, are you the dentist that did Cardi B? And that literally, to this day, is the #1 source of referrals for me doing smile makeovers. She's one of the reasons why everybody's getting their veneers, because she made it really popular and told everybody she got a bag and fixed her teeth. Hope you, no, it ain't cheap. We're not gonna say that word, but
I love it, yeah.
Everybody's wanting to get their teeth done.
Veneers are truly a quick fix, but what exactly are they?
A veneer is a thin shell of porcelain that is custom made, the thickness of a contact lens in most instances.
Okay.
And is used to mask discolorations. If you're not happy with the shape of your teeth, the length of the teeth, maybe your teeth have been affected by certain medications like tetracycline, where teeth whitening won't work, then you upgrade to a veneer. So think of this as the Lee press-on nails of dentistry. It literally just goes right over the front of your teeth. You put some glue in it. They're custom made. So again, we get to tell the lab the color, the shape, the size that we want. On our first visit, we'll get a replica of your smile poured up in stone. You can see the teeth were not positioned properly. There were some gaps between the teeth, a chipped tooth.
The mold is then sent to a dental lab, and
a week later, we don't have to glue them in. If you come back that second visit and you don't like the shape, color, or size, we can send them back. But once they are glued on, they are yours. The sides of your teeth are still yours. The back side of your teeth, still yours. The goal is for it to be very, very thin. Depending on the size and shape and position of your teeth, we may have to do some drilling. We may not. If your teeth are already in a good position and we don't have to create some illusions that your teeth have moved, then we may not have to do drilling, and that we determined in our first visit during the consultation.
So how do you get veneers you'll love? Ask lots of questions in advance.
It should really match the color of your eyes, be something very similar. So I'm usually kind of guiding you. Everybody wants white, 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 but that's not natural.
Right.
And when it comes to cosmetic dentistry, the goal, like plastic surgery and any other cosmetic surgery, is to fool the masses.
Right.
So if I can tell you have veneers, it's not a good job.
Dr. Austin transformed her own smile with veneers, so she's an expert and a patient.
Love to talk because they can't go put these in their mouth, you hear me?
She's weighing in on the controversial veneers of T.I.'s son, King Harris.
People felt like it didn't fit his mouth, and some people question he's, what, 18, something like that. The question, did he even need them? But, you know, when you're in the public eye, you feel the pressure to be perfect. His veneers were too white. They weren't properly sized, and you know what? He couldn't close his mouth very well, and I was listening to him speak. It really affected his speech.
Finally, can veneers come off? No surprise here. The answer is yes.
Anything that can happen to your own natural teeth can happen to the veneer. Now, my most famous client, Cardi B, is always on camera cracking crab legs, and I'm like, oh my God, I'm gonna get a call any moment. But luckily, for some reason, she gets lucky when she does that. But I'm always prepared. But don't, open bottle things with your teeth. Don't chew on ice. Just the common sense things that can ruin your own smile can affect the veneers.
And while veneers can boost your confidence, don't forget, good oral health should never be an afterthought.
Okay, so let's talk a little bit about the price. We alluded to it in the beginning.
Yeah.
It is not $9.99 per tooth. It generally starts about $1,500
Per tooth.
Per tooth.
I
And
would
they
need a
usually
whole
say,
mouth.
well, here's the deal. They usually say you get 3 or on the top, 3 on the bottom, so 6 or 8. You don't need to get the side. You don't need to do anything that isn't involved in your smile. So 3 on the top, 3 on the bottom minimum. Or do the 8, and it takes you to about here, and then the back teeth you don't do. But either way,
Does it hurt?
you need money. Apparently,
Because it's $1,500 a tooth.
I don't know, or a sugar daddy, or a rich uncle, or something. Deep pockets, you get the point.
Got it.
But it apparently is not super painful, and really, outside the consultation and the making sure that you like the mold and what they're going to do for you, you come back, and it's kind of one and done once they're made.
Yeah.
So celebs
I mean,
love it.
I've seen people who look amazing.
Yeah.
And then I've seen people that I'm
look
like,
I'm
like they've got the biggest chiclets ever. And
Exactly.
I'm like, I can't get my eyes off their
Right,
teeth.
you're like, what's happened
know.
to your teeth? But she said it perfectly. It's like good plastic surgery. People shouldn't go like, oh, who's your doctor? They should just go like, you look great.
Right.
Great smile. Not like, give me the number of the
Right.
person that hooked up your veneers. Okay? So just so you know.
Okay,
That's
good.
not the goal.
It's good to know, and thank you for introducing us to
Yes,
this
you got it.
doctor. Yeah.
You got it.